Dental fear and delayed dental care, combined with significant costs, are real issues plaguing and preventing people in Appalachia, in the region, from getting quality oral health care.
There's some research that estimates that only 61% of West Virginia adults visited a dentist in the last year. Numbers likely worsened by the pandemic, as you might imagine. As part of our series, Bridging the Great Health Divide, News Channel 3's Kelsey Soto takes us to WVU, where their dental school is working to try to improve health outcomes all across our region.
Oral health care is primary health care. You cannot separate the two.
After polishing off a career in the Navy, this alum came back to his old stomping grounds to steer the program.
Your mouth, your oral cavity is kind of the window to your body.
Dr. Stephen Pasciuta is the dean of WVU's School of Dentistry, a research and clinical facility where students get hands-on experience, really drilling down on the problems, getting to the root and gaps of care, and filling in those holes with treatment plans.
Many times we're that sole point of access for so many families who otherwise wouldn't have access to a dentist.
The class of 2022 is made up of 48 students from 4 countries and 11 states. Future dentists like Jason Selensky want to make the dental experience more personable and numb any fear.
Don't ever be scared of the dentist. They're here to help you. They're here to work with you. Have that conversation.
Jay spent years studying chemical engineering and then realized he craved something more, knowing the cavity in his heart could only be healed by helping others.
Taking an abscess tooth out, having them switch their diet, checking their blood pressure, that's stuff that we all do in a dental office. That can change so many things. I know it changed my life.
A switch in careers shined a light on his own undiagnosed medical condition. For Jay, being able to give someone back the gift of their smile or grant them a chance to eat their favorite foods again is an unimaginable feeling.
Taking away someone's pain is probably one of the best things, because you could just instantly see that moment of relief that they have in their eyes, let alone in their body language.
New this year is important oral coverage legislators fought tooth and nail for in 2020, getting West Virginia more in line with other states.
That is significantly changing the practice at the university here, but it's also increasing the opportunity for patients in the community to receive preventive dental care.
In January, new Medicaid benefits were unveiled. About 30% of the state's adult population will now have $1,000 to spend on their teeth, including dentures, implants, crowns, and corrective procedures like root canals. Under previous coverage, many patients had to wait until a tooth needed to be extracted before coverage even kicked in.
$1,000 doesn't sound like a lot, but you can do an awfully lot of preventive dentistry and restorative dentistry for $1,000. Once you get the restorative needs taken care of, it comes down to maintenance.
The American Dental Association says as of last year, there were 862 dentists in the Mountain State, which is about 2,100 patients per provider.
But when you get out into the coal fields, the southern coal fields, the Appalachia part of West Virginia, not so much with the concentration of population, which means that there's not as many dentists in that area to serve.
Dr. Pasciuta tells me 83% of dentists practicing in the state graduated from their program. The focus now is on educating the public about other health conditions, including diabetes and smoking, which can impact their dental health.
We need to look at ways of either bringing them into centers such as Morgantown, such as Beckley, such as Charleston, or pushing our providers and our students and our dentists further out into the communities.
For Jay, his crowning achievement will be restoring confidence in a patient, not only changing their smile, but their quality of life.
They're walking out with what you did, but more importantly, their life has changed forever, and they're happy and they're healthy.
Kelsey Soto, WSAZ, News Channel 3, Morgantown.
An estimated 310,000 West Virginian adults are eligible to take advantage of the added health benefit to their Medicaid plan. Poor oral health includes loss of teeth, impacts employability, your mental health, and a lot of other chronic conditions that you might not think are related to mouth issues.